Hi, my name is Yvette. I'm a UTA student nurse, and I'm going to be talking to you and doing a procedure with you that your doctor has already discussed with you. Can you verify your name and date of birth for me, please? Blue cup? Perfect. And your date of birth? 1171? Perfect. Okay, thank you. And can you tell me if you're allergic to iodine, shellfish, betadine, or latex? No? Perfect. All right, I'm going to perform some hand hygiene. And then I'm going to also talk to you about what this procedure that we're going to be doing is. It's called an indwelling catheter, which I know it seems like a lot. However, it's just you have some urine retention in your bladder. You're not able to go to the bathroom to pee. So we are going to insert a tube. It's going to go in through your private area into your bladder, and it's going to release that urine so you'll lose all that pressure in your belly and hopefully get some relief. And in the meantime, let's make sure we have some privacy. So we're going to close the curtain. I'm going to move the trash can over to where we need it, perform hand hygiene, and then I'm going to also get some other stuff set up because prior to putting the catheter in, we're going to make sure we are all cleaned. So I'm going to put on some gloves. And right here I've got some soapy water and it's warm. So what I'm going to need to do is raise your bed up to a comfortable position so I'm not stretching all the way down. And then I'm also going to lay you in what they call a dorsal recumbent position. And then you're going to bring your feet in about 2 feet apart and then let your knees fall out, relaxing, okay? And if you can help me do that, so I've got the patient positioned properly. And I'm going to perform the peri-care. So I'm going to make sure I wash the insides of her legs. Nothing is there. I'm going to wash around on her other side of her leg, under her bottom, make sure there's no feces or anything there. I'm going to start with the outside labia and clean there. And then I'm also going to do the inside of the labia on the inside fold there. And then I'm going to do down the middle. Okay, the patient is clean. And in the meantime, I'm able to cover her with a blanket and let her dry. So, get this out of the way. I'm going to remove my gloves into the trash can and then perform hand hygiene. Now I have my catheter package here. And first, before I do anything, I'm going to clean off my table, make sure it's nice and clean with a cleaning wipe. Throw that away. Perform hand hygiene again, and then I'm going to take a look at my kit and note that it is a 14 French with a 5 cc balloon, and the expiration date is 3/31/23, so we're good. Alright, so I'm going to remove the kit from the package, throw it away because I don't need all this stuff in the way. Now when I open this kit, I'm going to make sure that I've got my patient is now exposed. Okay, I'm going to fold out, and then grabbing my, I'm going to kind of push this forward a little bit and grabbing it. Now I don't need my gloves over there right now, so I'm going to put here. I have not put my hands in the sterile field, so I'm going to need to remove this fenestrated sheet and open it up close to the patient, but I'm not going to allow myself to touch anywhere but on the 1-inch border. And I'm going to put this under the patient, creating a sterile field. Okay. And now I'm going to don my sterile gloves. I'm not ensuring that I'm not going over the field where the fenestrated part is. I did have a fenestrated sheet for a male, but I got rid of that because I'm not going to use it. And I'm going to ensure that my thumb does not touch my sterile glove on this hand. All right, we have sterile gloves. I'm going to get rid of this paper, ensuring my hands do not touch, go below my waist. So now I have my catheter kit. I'm going to bring it over here, closer to the patient without touching the patient's legs. So I have my iodine that I'm going to use, and I'm going to open it and pour it all over the cotton balls and drop. I have my lubricant. I'm going to squeeze it into the container and then get rid of that because I don't need it. Now I'm going to move my kit over. I'm going to scooch this over just a little bit, give myself some room. And I have my saline. Now, I have to remember that the information on the box said that this is a 5 cc balloon, but I have 10 cc's of sterile saline in that tube. So I want to go ahead and attach it to my catheter. And I'm also going to remove the tubing from the plastic sheath, ensuring not to touch the patient or any part that is not in the sterile field. And then drop. I'm going to place this back into the box. Now that's prepared. Now I'm going to go ahead and dirty my hand so that I can touch and get the patient cleaned. So I'm going to hold with my left, open the labia, starting with the outside first, wipe down and toss. Inside, labia, and toss. And then down the center and toss. Now that is complete. Now I'm going to tell the patient that you might feel uncomfortable. I'm going to start putting this tube in once I get some lubricant on it. But I want you to know that I'm going to be as careful as I can. I'm going to ask you to breathe, and we're going to get through this pretty quick. Okay, so get some lubricant on there, about 2 inches worth. Make sure you've got a good hold of your tubing here. All right. So, all right, I'm going to start to insert this. I'm going to have a good grasp of this and make sure it's not floppy. I'm going to push in, breathe, breathe. And if I'm feeling resistance, I'm going to turn the catheter tubing. I'm going to push this in until I get urinary return. And I start to see urine. Now I'm going to use my dirty hand, and I'm going to go ahead and push in 5 cc's of saline. Make sure you remove it from the tubing or it will draw the water back out. And I'm going to slide this back gently, the tubing, and gently tug to ensure that it's staying in place. Now, I can dirty both hands. So I'm going to use the catheter bag. I'm going to take it, ensuring that the patient is still safe and comfortable. We've got some urine flowing out, clear yellow. I'm going to hook it on the bed and continue to let it drain. Okay. So now we're okay. We're finished with that. Are you okay, Mrs. Blue Cup? Okay, good. Not feeling any pain or anything? No? Okay, perfect. Now I'm going to remove my sterile gloves. I'm going to perform hand hygiene. I'm going to get another pair of gloves. I'm going to clean up my mess and make sure that our patient is nice and comfortable. So let's get this all out of the way. Are you still good? Okay, great. This is all done. I'm going to cover my patient. Still noticing some return. She had a lot of fluid in her. And then I'm going to remove my gloves. Lower the bed. Make sure 2 side rails are up. I'm going to make sure the call light is within reach, and then I need to go ahead and chart what I have done with this procedure. So in the room, I will be able to do that and still can kind of keep an eye on the patient. So I'm going to chart the indwelling catheter, the reason for the indwelling catheter, the color of the urine, the size of the catheter, a 14 French, the size of the balloon is a 5 cc. How many cc's of saline I did put in it was 5 cc. How the patient tolerated the procedure, the patient tolerated well. The patient has no further questions, and I'm going to make sure that the patient is no longer sitting in that dorsal recumbent position, but sitting in a position that's comfortable to her, and then measure how much urine is in the bag, because there's no more urine flow. Ensure that I have a measuring cup and a good reading of what that is. I'm going to note that. And patient is safe. And that's it. So thank you very much.